Well, good evening, everyone. My name is Dr. Stephen Castle. I am the Director of Operations for the ACVPM. I know when most of you joined the webinar, you're used to seeing Dr. Eric Toring. I'm going to be pinch hitting for him tonight. But we wanted to take this opportunity to welcome you to our inaugural Public Veterinary Practice Externship Travel Awards scholarship recipient presentations. We have three presentations that are planned for this evening. I do want to note that we will not be providing any CE credit for this particular webinar, but at the same time, I think this is a great opportunity to hear from our students and their travels and the opportunities that they've been afforded through the ACVPM. If you have any questions, this is similar to our webinars in the past. If you could put those questions in the Q&A section of the webinar, that would help us out greatly. Dr. Sierra Gwen and I will be monitoring those question and answers. We will actually be saving the question and answers until the end after all of the presentations have been given. But if you want to, you can put that in Q&A so we make sure that we don't forget about it towards the end of our presentation. So this evening we have three great speakers that are coming to us, students ranging anywhere from third year to about 1 month left in their veterinary school. So very excited to hear from them. Without further ado, I will turn it over to Dr. Sierra Gwen, and she will take us from here. Sierra?
Thank you, Stephen. Can you still see the slides?
Yes, we can.
Okay, great. I just want to make sure before I get into it here. Okay. So again, these are our students that we will be going in this order. And I just wanted to let everybody know, give everybody just a little bit of information as to how these travel awards came about. And so this is a collaboration between the Center for Public Veterinary Medicine, which is within the Virginia, Maryland College of Veterinary Medicine. And that, as you can see, that I put some notes there that are what that center is kind of focusing on, those careers outside of private practice. And then, as you guys know, for the diplomates, on the right-hand side is the American College of Veterinary Preventive Medicine, and you can see that there's a lot of overlap in those jobs. And so Dr. Rist is going to kind of talk a little bit more about the scholarship later, but that's how this kind of collaboration came about. And because we kind of share that same interest in supporting governmental vets, industry vets, academic institutions, and those kind of things outside of the private practice. Now I'm going to turn it over to Dr. Rist, who's going to introduce our first student.
Great. Thank you, Dr. Gwen. So I am Dr. Cassidy Rist. I'm the director of the Center for Public Veterinary Medicine. And we're excited to have this opportunity to introduce students. We've had this collaboration since 2024. And so this is our first time that we've decided that we're going to bring students in front of you all so that you can get a sense of where these funds are going and how they're supporting students in these careers. So to start it off, we have Holly Black. She is a fourth-year student at the University of Illinois College of Vet Med. She completed her MPH from the University of Minnesota in 2025 as part of their dual DVM MPH program. And her passion for veterinary public health developed during her undergraduate education at the University of South Dakota while researching tick ecology and tick-borne diseases for her honors thesis. Her vet school journey has prioritized research and public health experiences, including a fellowship with the Midwest Center of Excellence for Vector-Borne Disease, participation in the Summer Research Training Program, and working at the Illinois Veterinary Diagnostic Lab. So take it away, Holly.
All right, thank you so much. You can go ahead and go to the next slide. All right, yeah, so just thank you so much for the introduction. I'm Holly Black. I'm in vet school at the University of Illinois, and I completed my MPH last year, which makes sense since I'm very interested in public health. And my other interests include pathology and just getting involved in community medicine. So go ahead, next slide. All right, so my externship was at the Utah Department of Agriculture and Food, which is located in a town of Taylorsville, which is right next to Salt Lake City, Utah. I completed this in September, September 15th through the 26th. So it was a 2-week experience. And I was mentored by a variety of people at the Utah Department of Ag. So Dr. Amanda Price is the state veterinarian of Utah. And I worked with her, and my main mentor or like preceptor was Dr. Sabo. She is the assistant state veterinarian, and she is her priorities involve emergency and disaster response. Dr. Franco is one of the field veterinarians there. I rode around with him a lot. And then Jenna Crowder is the state apiarist, and I did a lot of training in bee medicine with her. Next slide. So the Utah Department of Ag, can you go back one? Thanks. Utah Department of Ag and Food is a pretty large regulatory agency state for the state of Utah. They oversee all the animals, and they also have like different divisions that oversee meat specific things, just general agriculture, like imports, health papers, things like that. They have a diagnostic lab. And I was really fortunate to be able to like network with a lot of people, even outside of the veterinarians that work there. So they have someone who's in charge of their elk populations, a fish guy. Jenna was great learning about bees and things like that. Their state entomologist, all those people I got to connect with when I was there. And it gave me a nice like big picture about, what all is involved in maintaining the health of the agriculture and food system in Utah. Next slide, please. So my primary goals when I went to this externship were to learn more about the Utah's like specific agriculture system. So just a little more background about me. I had been knowing I was going to move to Utah for a while after vet school because of like a family situation. So I wanted to network as much as I could to understand their agriculture, because it's very different in every state, and I'm originally from Illinois. So I definitely completed that goal, and then also get to understand the role of the state vet more. So I had previous experience working with the Illinois State Public Health Veterinarian, but not the state vet. So those are different roles, and I wanted to kind of understand what Dr. Price did a lot more. And then for networking, that was one of my other priorities. So I definitely accomplished that. I wanted to be able to meet as many people as I could, and then also ride around and meet producers and spend time like understanding who all comes together to like maintain the health of agriculture systems in Utah. And then spending time in the field, I definitely got to do that with Dr. Franco and with Jenna. Next slide. Okay, so now I'll just talk briefly about some of the things that I did when I was there. So New World screwworm is obviously like a very like hot topic right now, and I got to go with Dr. Price, the state veterinarian, to the state capital of Utah. So she was giving a talk to the Utah Senate, specifically a session on natural resources, agriculture, and environment. So she did a 20-minute presentation and then answered questions. And then I also got to sit in through the rest of that Senate meeting about like environmental and agricultural policy in the state. So that was really valuable because I think like the role of public policy and advocacy is really important, especially for agriculture, just public health in general. So I did that on my first day actually, and it was really cool. I went to a lot of meetings, so this is something that was often in person, but also remote. So Dr. Sabo, when I would shadow her, hang out with her, she would go into meetings that are between states. So veterinarians in similar roles to her collaborating about what kind of things are happening, like between like Colorado, Utah, Wyoming, Arizona, New Mexico, things like that. There would be like national level kind of meetings that she would attend. And I got to sit through all of those. And then there was also meetings within UDAF. So like with the meat inspection, that was one I went to. And then just like a whole all staff meeting. I also did a variety of facility inspections. So these were slaughter plants and doing their quarterly inspections. So I rode around with Dr. Franco to different places to kind of understand the background, like regulatory aspect of that. So meeting all the people he's talking to and then what he's looking for during those inspections, and then also kind of the paperwork or like afterwards part. Disaster response and emergency planning was definitely one of my favorite aspects of this. I got to travel up to Logan, where Utah State University is, and meet with their county along with Dr. Sabo to talk about disaster response and emergency planning. And this has a lot of stakeholders and a lot of different components and moving pieces. So that was really valuable. It was a pretty long meeting and kind of like identifying places where people and pets could go in an emergency and what those emergencies could be. So that could be natural disasters, that could be fires, it could be just like diseases and things, outbreaks, and talking about the role of all the different players that were at those meetings. Additionally, I was involved in some HPAI like meetings and then also just disease response in the state. I also went to a game bird facility, so there was new regulations about game birds. So this was a pheasant facility that I went to, and what kind of like inspections and regulatory things were required to be compliant in the state. So I traveled with Dr. Franco, and I helped test some of the birds there, and then also do a facility inspection. And then probably my favorite part was bee medicine. So I went to the entomology lab. I have a very like strong interest in entomology. I always have. And then working with ticks and tick-borne diseases, I'm very interested in anything related to bugs or arthropods. So the bee lab was really cool, and I got to spend a whole day out in the field with the county inspector and Jenna, the state apiary inspector and diagnostician. Learning about everything from how to handle bees, what are all the components of a beehive, what's the difference between commercial and hobby beekeeping, and then actually do some diagnostic testing, which was really cool. So that experience really stuck with me, and I'll talk a little bit more about that later. And then one of the other major components was laboratory tours. So I toured the Utah Public Health Laboratory, the Utah Department of Ag's specific lab, and then I also went to the Utah Veterinary Diagnostic Lab at the location in Logan, and then also the satellite lab in Spanish Fork. Next slide, please. So here's a little like fun look into bee medicine. So as of a couple years ago, veterinarians are required to be involved with the treatment of a European foul brood for prescribing antibiotics for bees. So doing that, like we don't learn much about bees in vet school, and this was a really great opportunity for me to supplement that interest and that like educational component, and having a lot of background about, you know, with any type of like agricultural production, like being able to relate with the producer, like understanding, you know, components of what goes into the, you know, like beekeeping is pretty important, in being a veterinarian and that communication piece. So I got to kind of learn from the ground up, like right out there in the field. And then afterwards, I've done more like CE training and things like that. But this was really where I got that interest in honeybee medicine. And it kind of came full circle. So the picture on the left of me, like holding bees out in the field, that was when I did my externship. But I developed really good connections with the Utah Department of Ag. So I was actually back there last week for my professional development, and I did an entire week about bee medicine. So I'm trying to get ready to be able to see bee clients of my own when I graduate, and I feel pretty good about that. So the other picture is me doing some diagnostic testing in the lab. I did like varroa mite counts, tracheal mite sampling, and then also some nosema diagnostics to see if there was any fungal spores in the bee samples. So very cool stuff. I learned a lot, and I'm very excited to like be able to directly apply this component of the externship when I graduate. Next slide, please. So yeah, my main takeaways from this experience is that bee medicine is really, really cool. And it's something that I know like every vet school has a different amount of like bee medicine exposure. Illinois basically has none. So this was really valuable for me. Also communication being like very critical for all veterinary fields, especially in like the government or public health spheres. So I witnessed communication between, you know, like state agency and federal agency, as well as within the state agency, and then like with producers or with just like other, you know, like professionals in the community that would kind of contribute to like One Health responses to emergencies and disasters. So that was really valuable for me. Diagnostic skills, so practicing with the bee medicine, and then also when I was at the diagnostic laboratory, I got to practice some of those things. And then team building and networking. I went to a few kind of like team meetings the Utah Rapid Response Team had a meeting when I was there. This was like a kind of all day, like 3/4 of a day thing. So I met a lot of people there. I also, when I was there, met the Utah State Public Health veterinarian, Dr. Lanier, and I'm actually with him this week for professional development. So I made so many connections when I was at this externship that have really like been valuable to me at this point and will be in my future career. And then emergency and disaster response planning. This is really cool because I felt like it was something that was very applicable to like me personally and then as a like clinician because I learned like, oh, I should probably have a disaster and emergency plan for me and my pets, but then also as a clinician, I can like spread that information about like, are you prepared for like if your apartment gets burned down or things like that to take care of yourself and your pets. So I think that was really cool, like very applicable component, even if like the way that I'll take it with me, especially in the next year, might be like talking to clients about their plans. So yeah, next slide, please. That is it. I guess I wanted to highlight one other thing I was kind of thinking about during this, but like the project component. So I had a few options for that, and I ended up not presenting my project because we had some like very interesting disease outbreak things come up that took precedence over me doing my presentation there. But I created some fact sheets for a variety of diseases. I think I did blue tongue and Rocky Mountain spotted fever that the Utah Department of Ag will use to help create their own fact sheets that they publish on their website. So that was kind of like the main project that I did when I was there, although I didn't get to present it to everyone. So yeah, I'm happy to answer questions or connect anyone with any of the folks in Utah if that's of interest. But yeah, thank you so much.
Thank you so much, Holly. We are going to have a short commercial break for there we go, for the American College of Veterinary Preventive Medicine, which I'm going to pass over to our communications person.
Well, I'm actually MNO, but thank you, Sierra. My name is Josie. I am the co-chair of MNO this year, which is Marketing and Outreach. So I am here to tell you about our wonderful college. So if you're not familiar with the ACVPM, we are one of the oldest college of specialty with pathology. And probably because, as one of our diplomats said, people like to eat and have clean water. And also because all of our practitioners are involved in preventive medicine, because this is what we do. We are also a small college with a lot of different expertise, which I believe makes everyone feel within a community of like-minded people. And I think it's a strong feeling within the college and the diplomats. I think as we just watched in the previous presentation, and as we will watch in the next two presentations, you saw great examples of the different jobs our diplomats are doing, but there are more, and there are so many, it would be very long to list. But if you are thinking to work with preventive veterinary medicine in clinical practice or outside of clinical practice, I invite you to reach out to the college, and our diplomats and the scholarship are good opportunities for this to learn more about the ACVPM. Thank you very much.
Thank you so much. And now we're going to come back to Dr. Rist, if I can find my advancer. There we go.
Great. So I'm excited to introduce our next student speaker. Alex Isler is a fourth-year veterinary student at Texas A&M, pursuing a DVM and a Master's of Science in Veterinary Public Health Epidemiology. Her training has been shaped by a growing interest at the intersection of animal, human, and environmental health, and in the systems that underpin disease surveillance, outbreak response, and food safety. Through both clinical and public health experiences, she's developed a particular appreciation for how veterinary medicine contributes to population level health in ways that are often indirect but deeply impactful. Most recently, she completed an externship with the Oregon Health Authority through the CDC Epidemiology Elective Program, where she worked on Campylobacter surveillance and participated in outbreak response and public health education. She plans to pursue a career in preventive medicine through service as a 64B in the U.S. Army Veterinary Corps, with long-term goals of becoming a diplomat of ACVPM. So thank you, Alex. Take it away.
Hi, thank you so much for this opportunity to present this evening. Thank you for the introduction as well. My name is Alex, and I'm a fourth-year veterinary student at Texas A&M. I know some of my classmates are currently in the audience, so I just want to shout them out. Thanks y'all for coming. This presentation summarizes my externship with OHA in the ACDP, completed through the CDC Epi elective program. This was from January to February of this year under the mentorship and guidance of Dr. Rosalie Trevejo, one of the state's epidemiologists. I'll walk through the work that I was involved in, what I learned, and how this experience shaped my understanding of veterinary public health. So this externship was completed through the CDC Epi elective program at OHA. The work focused on communicable disease monitoring, investigation, and response at the state level. What stood out to me early on was how interconnected everything was. You have surveillance systems, lab diagnostics, outbreak response, and cross-agency collaboration. These were constantly informing one another. This was my first time seeing how these systems operate together in practice and how public health decisions are shaped not just by data, but the infrastructure as well. We'll go on to the next. My goals going into this externship were to build skills in surveillance and applied epi, particularly within enteric disease. I also wanted to strengthen how I interpret data, not just perform analysis, but understand what the data represents in context. Another goal of mine was to gain experience in communication response, particularly how information moves across agencies and also during public health events such as outbreaks. My education has introduced me to these concepts, but the experience was different. It allowed me to begin developing judgment and practical understanding, which will ultimately shape how I apply those skills in real settings. We can go on to the next. So my work fell into several main areas. On the surveillance side, I worked on a Campylobacter Diagnostic Trends project using the Oregon FoodNet data, and I also reviewed Campylobacter tracker data, evaluating interview completion, follow-up patterns, and gaps in case investigation. In terms of fieldwork and response, I participated in a high-path AI dairy herd investigation with the Oregon Department of Ag and observed discussions related to measles response and incident command during several clusters of measles. I also contributed to public health communication by giving a guest lecture at Portland Community College on enteric disease from a One Health perspective. And across all of these, collaboration was constant, working across epidemiology, lab teams, agriculture, and public health leadership. Next, please. So my primary project focused on Campylobacter diagnostic trends over time. From 2015 to 2024, culture-positive cases decreased from 840 to 300, which is a 64% decrease, while CIDT positive cases, that is cases identified via antigen or PCR, these increased from 28 to 200 or 757, which is more than a 2,600% increase. Overall, incidence only gradually increased, which supports the interpretation that improved detection contributed to this observed rise. This shift is important because our confirmed cases, they are historically defined as cases diagnosed by culture, whereas CIDT cases, these are considered presumptive despite the fact that they are used more frequently now, and they are often more sensitive than culture, specifically for Campylobacter. So this creates a disconnect between how we detect disease and how we define it, and it raises the question of whether case definitions will need to continue to evolve to better reflect current diagnostic practices. Next, please. Focusing on several severity markers, what stands out is specifically hospitalization. we saw that hospitalized patients were more likely to be diagnosed using CIDTs. It's really important to interpret what that means in context. CIDTs are faster in terms of their diagnosis, which makes them more useful in acute or severe clinical settings where rapid decision-making is needed. At the same time, insurance and clinical workflows often do not support performing multiple tests, so confirmatory culture may not always be pursued, even in more severe cases. So as a result, patients that are more severely ill may still only be categorized as a presumptive case rather than a confirmed case, which has implications for how we interpret severity and surveillance data. Next, please. One of the biggest challenges for me was working with real surveillance data in R for the first time. I've used several different modeling softwares, but I've never used real data before. So besides the technical learning curve, interpreting multi-year trends influenced by COVID, diagnostic shifts in healthcare systems also added complexity. And I just approached this by troubleshooting, seeking feedback from my mentors, and refining my approach while focusing on transparency and interpretation. It's important not to overinterpret as well. What this taught me is that public health data requires humility. It's not just about analysis, it's also about understanding the systems that shape what we observe. Next, please. So this experience deepened my understanding of veterinary public health beyond its conceptual framework and into its operational reality. What became most apparent is how much of our work depends on the interaction between systems, diagnostics, lab capacity, reporting structures, and clinical decision-making, all of which shape the data we rely on. I also gained a clearer appreciation for how surveillance functions as both scientific and logistical system. So this requires coordination across multiple disciplines to be effective. And from a practical standpoint, this experience strengthened my ability to interpret data within context rather than within isolation. More broadly, it reinforced that the role of veterinarians in this space is not only technical, but also interpretive and integrative. We bridge data, systems, and decision-making in ways that directly affect our population health. Next, please. And in terms of my professional development, this experience has a direct impact on how I view my future role in vet med. As a future 64 Bravo in the Army Veterinary Corps, I'll be involved in enteric disease prevention, food safety inspections, and protecting public health through regulatory and preventative frameworks. This externship allowed me to see the other side of that work, how surveillance data is generated and collected, how outbreaks and clusters are identified, and how decisions are made before they reach that regulatory level. And it continued to strengthen my interest in preventative medicine and applied epi, and it reinforced that ACVPM is a meaningful long-term direction for my career. Next, please. In conclusion, this experience represented growth, not just in my technical skills, but also how I think. Public health has made veterinary responsibility visible at a population level, but it's also made clear how interconnected diagnostics, surveillance, regulation, and response truly are. And I'd like to just take a moment to shout out OHA, all the teams there, and Dr. Trevejo, Dr. DeBess, and all agency partners who contributed to this experience. Thank you.
Great. Thank you
Okay.
so much, Alex. Oh, sorry, Dr. Gwen.
Oh, no problem. Yep, I was just going to, Dr. Rist will come up again for a small commercial for herself, but I do want to say, Alex, you are a better person than me because R has, it's hard. I don't get it. It's beyond me. Congratulations.
Thank you. It was a steep learning curve.
Great. And just as a reminder, if you do have any questions for our students, go ahead and put it in the Q&A. But while you're thinking of your questions, I would like to just share with everyone about a little bit more about the Public Veterinary Practice Externship Travel Awards. So in the beginning, Dr. Gwynn mentioned that this is a partnership between ACVPM as well as the Center for Public Veterinary Medicine. Our center is located at the Virginia Maryland College of Veterinary Medicine, but we do, as you can see, serve students broadly across colleges. Um, and one of the things that we were really excited to partner with ACVPM on was being able to, um, their ACVPM wanted to be able to support students who had an interest in preventive medicine and in these areas. And we at the CPVM have an interest in serving as a National Center of Excellence and trying to get these opportunities out to students to make them aware. And so it was a great partnership where we can help get the word out about these opportunities to students. And deal with the logistics of managing the applications and all of that. And ACVPM gets to fund these awards and know that they're really supporting the next generation. So, as I said, the purpose is to support that education and training of veterinary students interested in preventive medicine fields. And there's a variety of things: public health, food safety, epi, emergency management. We get applications for all kinds of things, all kinds of opportunities. Requirements or eligibility is that students have to be third or fourth year students. And it must be an externship that is for credit. So these are funds that don't just support extracurricular, but really needs to be something that's going to be for credit in their veterinary program. Originally, it started out at $1,000 to a student's. And now ACVPM has bumped that up because they recognize the need, up to $1,500 per student, up to 10 students a year or 5 students at each application time point. So our deadlines are March 1st and October 1st annually. And we'd really appreciate everyone on here. If you weren't aware of this before, please help us spread the word. The more students that are aware of this opportunity, the more applications that we get, and hopefully we can continue to fund this. So it is competitive, but we'd be happy to see additional applications coming in and making sure we're spreading the word. So with that, and certainly happy to take any questions about that at the end as well. But it is on our website for those who'd like to share the opportunity. Our last speaker tonight is Toni Rabasco. She is a third-year VMD candidate at the University of Pennsylvania School of Vet Med, and she's interested in wildlife pathology and conservation medicine. She conducts research through Penn Vet's Wildlife Futures program, focusing on avian disease surveillance, including eastern equine encephalitis and highly pathogenic avian influenza and free-ranging wild birds. She holds a Master of Science in Conservation Medicine from Tufts University, and Toni is passionate about applying One Health principles to conservation-focused research and pathology. With that, I'll hand it over to you, Toni. Oh, you're on mute.
Great.
Someone had to do it. Someone had to.
Yes, I had to do it. Thank you so much for the introduction, and it's been really cool again to see everyone's experience so far. So, yeah, like she said, my name's Toni, and so my externship, I was in Thailand, and at WFFT. And so I'm going to go into like the introduction, context, and goals, and then more just about the personal experience and what I learned and everything. So just some background first. This is Thailand's first dedicated wildlife hospital. It rescues, rehabilitates, and also promotes lifelong sanctuary care for the wildlife that needs it. And they also have a lot of cool programs that combat illegal wildlife trade and exploitation for entertainment. And they help educate communities and tourists and volunteers about this. And they make a lot of great strides in release efforts of the rehabilitated animals. So why I chose this, I thought it would be a great skill set to learn in a more like rural setting. And it was more like field-based setting. And it's cool to see how wildlife medicine is practiced in different parts of the world. And I also thought it would just be really cool to connect with other people who are also passionate about the wildlife. And so the skills I hope to gain and the objectives, it was to have more comfortability in doing like exams and diagnostics and species that I'm not exposed to every day. I thought it'd be a really cool opportunity to be part of a multilingual team, and be able to work further upon my like data analysis and field surveillance skills. And the One Health decisions that kind of go into the rehabilitation process. And next slide, please. So a little bit about the activities and responsibilities. I kind of broke it down into 4 parts. So first for the wildlife hospital and rehabilitation, we had daily rounds. And after rounds, we would do physical exams, and we then would like do any surgeries and do anesthesia, any like wound care and treatment plan. And then the community spay and neuter clinic day. It's where we did patient intake of the local people's like pets, but also the strays that lived around WFFT. And we would do like spays and neuters. And I got to participate in that and also help out with being able to get more comfortability with induction and monitoring and recovering. And then the fieldwork and environmental enrichment side of it, a lot of the times, some of the injuries that these animals had, we would have to treat them in the enclosures. So we did a lot of like field-based triage in and around the sanctuary. And then for the research component, my mentor, Dr. Zimmerman, who connected me with this wonderful hospital, we're doing like a hepatitis B virus in gibbons. And so it's kind of working on like the HBV prevalence in captain gibbon populations using like blood, saliva, and feces. And we're trying to coordinate through centers on how to research this more with non-invasive diagnostics to try to help in the future inform management decisions like for gibbons and serology. And next slide, please. So some of the key learning and insights was I thought it was an amazing opportunity to see One Health in action. Just being able to work at the wildlife hospital every day and then combining it with like the spay clinic program, it was really cool to see a way how community can come together to like accomplish the same goal. And I think being in a rural setting, it helps sharpen my triage and clinical problem solving skill in a working in like the field. And I feel like you have to be, it taught me how to be more adaptable and kind of think more on my feet. Um, and then just like the exposure too, I got some hands-on skills with like sun bears and I woke up like a macaque from anesthesia, which I've never done before, and it was like quite intimidating, but it was such a surreal moment, and it just gave me more confidence in my clinical skills. And then with the community engagement, I learned so much there from like the nurses and the volunteers and the doctors. And they know so much about their personal wildlife, and it's really cool being able to learn about the knowledge and the hands-on skills that they recommended I do. And that photo, if you're wondering, that is a cat that lives at WFFT, and his name's Turtle. And you can always find him napping with the other turtles when you need to look for him because he needed some wound care. And next slide, please. And so my the impact on my professional development, um, it helped strengthen my commitment to wildlife medicine and pathology as a career. I love the way that it can combine, like working at a hospital like at WFFT, it can combine the conservation medicine with the International One Health framework. And it was really cool being able to develop those skills more and build more knowledge on wildlife physical exams and monitoring and diagnostic skills. And just I'm in my 3rd year, so I'm in my rotations, and this experience has really taught me how to be more detailed oriented and like think out of the box and everything when doing my physical exams and everything. And it definitely helps show me a new areas of interest. And like for example, the primate health surveillance, I didn't have a lot of knowledge in before, but reading up about it showed me that epidemiology is a really cool career path that could be combined well with the wildlife medicine aspect of it. And next slide, please. Awesome. And then challenge and adaptation. So there was obviously a lot of unfamiliarity with some of the patients that I had. So a lot of like the drug dosing and what the normal physiology of the animal is and the handling. Whereas often it was uncomfortable at first, but I learned how to rely on the mentorship at the veterinarians and the nurses and the volunteers that work there. And they had a lot of different like exotic animal references books that I've never seen before in the US. And it just showed me how wildlife medicine can really help you be more creative and more adaptable, especially when you're working in the field. So I felt really lucky to be able to learn from them all. And then the language and communication barriers. So coordinating with Thai staff, I learned basic veterinary vocab in Thai contexts, and I would carry like a mini like English to Thai pocket dictionary to try to learn more words like on the job and help me remember them easier. That really helped a lot. And then sometimes even like during surgeries, we over time developed like a visual and gestural communication strategies to kind of um, signal like what is next needed like in the surgery. And then I also downloaded an app that I would type English into and it would come out in Thai. So that was super helpful as well. And next slide, please. So a project highlight. So my mentorship for this project and externship was under a doctor named Dr. Zimmerman, and we kind of try to like kickstart this website, and the link is here if you're interested in learning more about it. But it's called the Gibbon Health Initiative, and it's so all like 20 species of gibbons are either like threatened or endangered, and so GHI tries to like bridge that gap between like zoo-based and field-based veterinary care globally. And so right now I'm working on the portal of the About Gibbons page to kind of just raise more awareness about this and like what we can do and try to like just reach out in a capacity volunteering way. And then also the research in the hepatitis B, we're trying to find a way to use like non-invasive techniques to track more of this disease, to improve like health surveillance and zoonotic disease risk assessment in primate conservation settings. Next slide, please. And so from my experience at WFFT, I learned so much effective skills in conservation medicine through like the community and the volunteers and the doctors. And I felt very lucky to be able to experience that, whether that was in the wildlife hospital or with like the spay and neuter clinic. It definitely sharpened my technical skills and also my understanding of how to make these calls in rehabilitation and just seeing the way that they handle high stress situations, like when we had to like dart a wild boar and it was getting really anxious, like what we should do next and everything. So I felt really lucky to be able to sharpen those skills and be able to witness that. And but yeah, in this externship, it was made possible through ACVPM, and I feel incredibly lucky for it. So thank you so much. And thank you to the entire staff of WFFT and the nursing staff and the volunteers. I learned so much from everyone. And as well as Dr. Zimmerman for your mentorship and support and connection to this hospital. So yeah, and if anyone's interested in this experience or would have any questions, I'm more than happy to answer them. So thank you so much.
All right. Thank you, everybody. I am going to take just a minute to wrap up right before if we get to any questions. Um, so let's see. This thing doesn't respond every time. Okay, so up here is the links for both of the programs that the websites for that give the things. I also wanted to take a minute because I was trying to think, and I'm so upset because I forgot that Dr. Turing was not going to be able to be here. Um, because Dr. Turing, for those of you in the college, know he he works so hard, and he's hard to make laugh, and he's a very serious kind of guy. And so I wanted to thank him for his work, and for, we come up with these ideas, and then we're like, hey, you have to be here for this webinar when we need. And so I did a little Googling, and I learned a lot. And I did not know that Dr. Turing is actually a brigadier general, retired in 2019, and I just thought that was really amazing. And I just wanted to know that I was really proud, because uh, that's a really huge honor. And then I also wanted to thank Dr. Cassidy Rist, which I do have a fun picture of her. And she does so much with the students, particularly at, even not just the students at Virginia, Maryland, which I've seen actual, her interactions with, which are wonderful, but with the students in all the different schools and all the different places, to bring more people into preventive medicine and more people into government and research and industry. And I think it's wonderful. And so I just thank them for being able to support the students, um, kind of have these activities, and then hopefully be able to add to our college with their knowledge and experience and youth. Thank you.
Okay. Cassidy, did you have anything else to add at the end
No,
there?
I was just gonna say thank you, and I had a question if there aren't any other questions from the audience.
There was just one comment, not necessarily a question, but I'll just read this. It says, no question, but this scholarship program is amazing. And it's been wonderful hearing how this has positively impacted the students. Thank you to the students for sharing, and to ACVPM for creating this opportunity. And I would echo that. I think as far as our inaugural go at it, great job, ladies, in the presentations. And I'm a little jealous because, yeah, I would like to do all of those things, and learn more about bees and go to Thailand. And again, I'm with you, Sierra. The R, I'm like, boom. So, anyways, yeah. So let's see if there's any other questions. Again, if you can put that in the Q&A section. And Cassidy, if you have one, please go ahead.
Yeah, just really quickly, if each one of our student presenters could just say maybe a word of advice to, if there are any other students on here, about how do you find these opportunities, how do you reach out, and anything you can do to give, even if there's faculty on here or other folks who might be counseling or giving guidance to students, what are the ways that students can find these opportunities and know that they're good ones? And since I asked all of you, why don't we go in order of the presenters? So Holly will go first, then Alex, then Tony.
Yeah, I think my biggest piece of advice for students like interested, especially in like public health and these different like agencies and spheres, is to like just reach out and network as much as you can. Like, I really wanted to get a job in public health in Utah, but there just aren't a lot of opportunities at this exact moment. However, I have met so many people along the way, and today it really came full circle. Today I was with the state public health veterinarian in a bunch of meetings, and there was a meeting where I knew more than half of the people in there already from my experiences in Utah back in the fall, thanks to you guys and that funding. So I think that like really made me feel like I have done like a lot of really great work with connections, and I think that those are the ways that I will find the opportunities in the future, career wise. So I that's my biggest piece of advice, is to just reach out and never be scared to cold email people. That's what I did, and it worked out in my favor. So
Great, thank you.
Sorry, that was my cat. On a similar note, I would say, again, networking is very important. I think you can network in a lot of different ways. So outside of just your faculty that are at school, one thing that I have commonly done, to the chagrin of probably those that I annoy, is going to conferences, or attending CE events and things that I'm interested in, even if they're on webinars. Like, you can find contact information very easily online nowadays. So specifically, I would follow your interest, or follow something that, like a tool in your toolkit that you want to build. Like, I knew that I wanted to build like investigative and surveillance work, especially with coding, because it's not something I've done before, whereas I've done a lot of field work but follow your interests or continue to build that toolkit. And yeah, just echoing what Holly said, there's nothing wrong with cold calling or cold emailing. You can also find a lot of things when you're panicked or desperate. It was very unclear if the CDC program was going to happen this year, so I cold called a lot of people in the public health sphere, and everybody's very just like happy to help build students up. So nothing wrong with that.
Great. Yeah, in a similar type of way, like I found my mentor, Dr. Zimmerman, who works closely with WFFT. I met her through talking with one of my professors at Penn Vet, and Dr. Zimmerman doesn't teach at Penn Vet, but she works like through the Smithsonian. And so I think, yeah, I think going out of like your comfort zone, I know it can definitely be intimidating to approach like your professors, but it's always such a great way to like really get to know them on a personal level. And because I did that, um, she was like, "Oh, I should introduce you to Dr. Zimmerman." And then I met Dr. Zimmerman probably about like a year ago, so we've kept like doing some work together. And so when I was looking for externships, this all kind of like fell into place really well. And so I would say, yeah, like getting out of like your comfort zone. And I think the saying, it's like you never know if you don't try is very helpful in life because, the worst they can say is no or something. So yeah, very similar to what they both said too, but just reaching out to the contacts that you have and just putting yourself out there and being okay with being uncomfortable sometimes, and it gets easier. But yeah, thank you.
Thank you guys. And I would echo, or I would kind of highlight this thought that I tell this to students a lot too, is that in the preventive medicine world, in veterinary public health, it's a small world, and usually it's a very cool world. And most of the people who work in this field are excited to help students who have those interests because we've all sort of struggled and had to find our paths in different ways, and so we know what it's like. And we love to meet people who have that passion and that interest. So it is we're quite friendly folks, in my opinion.
Okay. There was just one more question that came in, and it was how do the students hear about this award and possible externships? So I think we've kind of answered that question previously. And then Holly put in our chat that the Veterinary Public Health Network Facebook group is a great way to learn about the scholarship. So Holly, thank you for putting that in the chat there. So I will give it one more chance to see if there's any questions that we can put inside the Q&A. And if not, I would like to turn it over to the president of the ACVPM, Dr. Kristen Voll, just for a few words to close us out.
Hi, thanks, Stephen. Yeah, hi, I'm Dr. Kristen Voll. I'm currently the president of ACVPM for a few more months. And I just want to thank Dr. Gwynn and Dr. Rist and Marketing and Outreach for coordinating this presentation. This has been excellent to hear about all these experiences. ACVPM is really excited to be able to offer the travel scholarships, and this was just fascinating to hear about what all of the students are doing. And thank you to the students for taking the time to share about your opportunities and what you were able to learn. And we really hope that in a few years you consider applying to become a part of ACVPM. I think it would be fantastic to have you as part of the college, and we're excited to see where you go in your careers. So thank you again for taking the time. This has been a really great experience to hear what you have been doing.
All right. Thank you, Kristen. And I think we are just about at the hour. So great job to all the speakers again. Really appreciate all the hard work that you put in. I just wanted to remind everyone this was we recorded this, and the recording will be available on our YouTube page in about 7 to 10 days. So you can go back and review any of those sections or the presentations that were given. So with
Thank
that,
you, everybody.
Yes, thank you. And
Well
good
done.
evening, good morning, good afternoon, wherever you are in the world. Thanks for joining us. Have a good night.